I can't emphasize enough regarding the critical importance of macroscopy in evaluation of testicular tumors. Follow these three simple steps to avoid mistakes. First, always take your spermatic cord margin before you open the specimen. And the goal is to avoid the knife edge artifacts that may result in a pseudolymphovascular invasion, like an example seen here. In addition, knife edge artifact also often results in false positive margins. So here you can see that due to edge artifacts, the poorly preserved cells, they often push into lymphovascular spaces as well as at different margins planes, and can result in a false reading, while a true lymphovascular invasion has very well preserved cells, often assuming the shape of the blood vessels with an endothelial attachment at one of the planes, and often you see red blood cells within these spaces. Second, always allow adequate formalin fixation of the tumor before taking sections, and the goal is to avoid confusion of poor preservation in the classification of tumors such as seminoma cells mimicking embryonal carcinoma due to shrunken nuclei and cytoplasmic loss. As seen here in this particular example, the fixation is not adequate, and because of that you have a cellular crowding, and that may result in kind of over-interpretation of seminoma as embryonal carcinoma, while this particular example shows nicely preserved tumor cells showing a characteristic morphology of seminoma and embryonal carcinoma. Third, take an adequate number of sections from the tumor that have differing gross appearances. This is very critical to avoid misclassification of germ cell tumors. Each of these germ cell tumors have a characteristic gross appearance. Seminoma characterized by homogeneous gray-white, tan, often flashy cut surface, while non-seminomatous germ cell tumors typically have a more variegated cut surfaces with areas of hemorrhage, necrosis, and cystic change. So when you see this type of appearance, always take multiple sections from different part of the tumor to avoid misclassification of germ cell tumors.